It turns out that kale might be doing more than protecting your arteries. It could be saving your wallet from open heart surgery. While we often talk about healthy diets in terms of waistlines, blood pressure, or how smug you get to feel after eating chia pudding, there's a bigger, less sexy, but massively important dimension: the cost. Specifically, how much money we and our healthcare systems could save if people over 60 simply ate a bit more like they lived near a farmer's market and a bit less like they lived inside a vending machine. The economic consequences of diet quality in aging populations are no longer just the stuff of vague policy hand-wringing. They are measurable, sobering, and in many ways, preventable. Older adults who adhere to high-quality diets, like those measured by the Alternate Healthy Eating Index, DASH, or Mediterranean patterns, consistently show reduced healthcare utilization, fewer hospital admissions, shorter stays when admitted, fewer medications, and fewer chronic conditions that require costly long-term management. And if that sounds like a win for the national budget, it absolutely is. Let's talk numbers. Several large cohort studies, like the NIH Diet and Health Study and the Health and Retirement Study, have linked better dietary scores in mid to late life with significantly lower Medicare costs over time. For instance, one analysis found that older adults in the highest quintile of diet quality based on the HEI, Healthy Eating Index, incurred roughly $1,200 to $1,500 less per year in healthcare expenditures compared to those with the lowest quality diets. Now multiply that by tens of millions of people over 65, and suddenly your broccoli habit looks like a national economic strategy. What drives this savings? Primarily the reduced incidence and severity of high-cost, high-burden diseases. Think type 2 diabetes, heart disease, stroke, and kidney failure. These are not cheap conditions. Managing diabetes alone can cost over $10,000 per patient per year. Preventing it by shifting diet quality? Less than a weekly grocery bill's difference. The savings compound when you add reduced need for surgeries, rehab, prescriptions, and the avoidance of slow-burning costs like dialysis or long-term assisted care stemming from preventable strokes. Hospitalization data makes the case even more dramatic. Poor diet quality is associated with higher rates of emergency room visits and inpatient hospital stays, especially for cardiovascular events and acute complications from chronic conditions. In contrast, adherence to anti-inflammatory, nutrient-dense diets is associated with better immune function, fewer infections, and better post-operative recovery, translating into fewer readmissions and complications. Even seemingly soft outcomes like sarcopenia, age-related muscle loss, and frailty, both highly influenced by protein quality and micronutrient intake, affect fall risk and hospitalization odds. A bad diet can literally trip you up, and a good one can keep you standing longer, both metaphorically and physically. And let's not ignore medications. Polypharmacy is a major economic and clinical issue in aging adults. A poor quality diet often means more prescriptions for blood pressure, cholesterol, blood sugar, inflammation, and eventually pain. Conversely, nutrient-rich diets rich in omega-3s, magnesium, fiber, and antioxidants can reduce reliance on many of these medications, meaning fewer side effects, fewer interactions, and fewer pharmacy visits that feel like tiny mortgage payments. Critically, the benefits of diet quality extend even in older age. This isn't a "you missed the boat if you didn't eat well in your 40s" situation. Interventions in populations over 65 have still shown meaningful improvements in both outcomes and costs within just a few years. In fact, studies from programs like the Medicare Diabetes Prevention Program and community-based nutrition assistance have shown that targeted support for better eating can yield ROI, return on investment, within 12 to 24 months. That's faster than most gym memberships pay off. And here's the punchline: you can't expect people to eat well without making it possible. Socioeconomic status remains one of the most powerful predictors of diet quality, and food insecurity in older adults is a quietly growing crisis. If we want to reduce healthcare costs through diet, we need policy that makes healthy food more available, affordable, and culturally relevant. That means subsidies for produce, support for Meals on Wheels type programs, and less corn syrup disguised as public nutrition policy. Ultimately, when we ask, can diet quality lower healthcare costs in aging adults? The answer is a resounding yes, but only if we stop treating food as a lifestyle accessory and start treating it like preventive medicine. The path to lower healthcare bills may not lie in fancier treatments, but in humbler meals: lentils over statins, olive oil over beta blockers, and maybe, just maybe, fewer emergency room visits because someone chose brown rice over boxed mac and cheese. So, yes, food is expensive, but not nearly as expensive as a poorly fed population.